with Ukraine, whatever is thrown at Ukraine, until they have the freedom and security that they deserve. Mr. Speaker, this government is restoring the founding promise of the National Health Service to bring quality healthcare to all, regardless of how much you earn or where you live. New funding for GPs is being prioritised for areas where the need is greatest, and we're sending more cancer specialists to rural hospitals. As we modernise the health service, the NHS app and NHS Online will bring world-class healthcare to the most remote corners of our country at the touch of a button. Lots done, lots more to do.
Thank you, Mr. Speaker. In places like Nahill and Near, going the extra mile to provide care is part of the job, and I'd like to pay tribute to the carers who, in my constituency, who travel over miles in darkness and in bad weather to deliver support for the elderly. But in some parts of the Western Isles, and indeed across rural Scotland, there simply isn't the working age population to provide that care. And immigration can't solve that problem entirely. Does the Minister agree with me that it's only by increasing wages, by paying social care staff properly, something Scottish Labour has been calling for some time, that we will increase the number of carers in rural areas and provide a proper care service?
I wholeheartedly agree with my honourable friend. This Labour government is introducing the first ever fair pay agreement for care workers. That's better pay and conditions for care workers and more people recruited into the profession. It's backed by £500 million and Scotland will receive extra funding through the Barnett formula. So the question for the SNP is, where's the money going and why isn't it going into the pockets of Scottish care workers as Jackie Baillie has demanded?
We now go to the Chair of the Select Committee, Leila Moran.
Mr. Speaker, on Friday I visited Young Devon, an early support centre in the heart of rural North Devon. And there I met young people who told me heartbreaking stories of how they felt left out and let down by the system. Young Devon was quite literally a lifeline for them. It has an open-door, person-centred approach, and I'm so delighted that their funding has been continued for one more year, but it's one more year and only 1 year, and they tell me it makes it incredibly difficult for them to plan. So can the Secretary of State clarify, what is the longer-term plan for these early support hubs? How do they sit alongside Young Futures hubs? And how can he help organisations like Young Devon thrive into the future?
Can I join the Chair of the Health Select Committee in paying tribute to Young Devon and the work that they are doing? And as she will know, I have enormous sympathy for the challenge she raises about medium-term certainty in funding. As I think was demonstrated on the floor of this House yesterday by the Education Secretary, my department and Department for Education are working closely together to make sure we're better joining up education and health provision and support for young people. There is more to do. I accept the challenge she sets down around medium-term certainty of funding. That's why we're doing more in terms of things like the medium-term planning framework. But I'd accept, in the spirit of this exchange, lots done, but lots more to do, certainly.
Helen Morgan, Liberal Democrat spokesperson.
Thank you very much, Mr. Speaker. Last year in Shropshire, which is a fairly typical rural area, 158,000 patients waited more than a month for a GP appointment. And that's not surprising, given, like many other rural areas, we have 50 fewer qualified GPs than we did a decade ago. Meanwhile, already busy GPs are trying to develop integrated neighbourhood teams, but they're reporting that they haven't received any dedicated government funding and still don't have the model neighbourhood framework. Will the Secretary of State act to ensure that GPs have the resources and guidance they need to develop those neighbourhood health teams and ensure that everyone can access an appointment within 7 days or 24 hours if it's urgent, particularly in rural areas where provision is poor?
I'm grateful to the Liberal Democrat spokesperson for her question. A few things to say in response. Firstly, we have 2,000 more GPs now than when Labour came to office. But she is absolutely right to say that we need to make sure that provision and increase in capacity is reflected right across the country. GP practices serving more deprived areas receive 10% less funding per needs-adjusted patient than poorer parts of the wealthier parts of the country. So we're reviewing, reforming the Car-Hill formula to make sure that we get the right funding to areas of greatest need, and recognising that amidst our rural communities are obviously lots of affluence, but also enormous pockets of disadvantage and deprivation. And whoever you are, whatever your background, you need to get the support and the care you need in the right place at the right time.
Ray Morris.
Number 2, Mr. Speaker.
Minister.
Hear, hear.
Thank you, Mr. Speaker. The National Cancer Plan, which I launched not 2 weeks ago will end the postcode lottery. Wherever you live, you will get high-quality cancer treatment. We've already invested 70 million in 28 new radiotherapy machines, cutting-edge machines, reducing waiting times and providing 15% more treatments, which allow 27,500 extra patients to be treated every year. This means more equal access and better outcomes for cancer patients across England.
Red Morris.
Can I thank the Minister for that reply and applaud the ambition set out in the cancer plan. My question's about improving access to advanced therapeutic radiotherapy. But can I point out that almost half of the cancer centres in more urban areas in England experienced a staff recruitment freeze. That figure rises to 60% in more rural and deprived areas like mine in East Durham. So will the Minister set out what steps she's taking to end these recruitment freezes to ensure cancer patients, irrespective of where they live, can access the life-saving care they require?
Minister.
I thank my honourable friend for his question, and I commend his continued advocacy for radiotherapy. I also met with the member for Westmoreland and Lonsdale and the radiotherapy APPG to discuss how this government will improve outcomes for cancer patients. And while trusts retain responsibility for recruitment, we are continuing to increase our cancer workforce. From November 24 to 25, the cancer workforce grew by more than 4%. The cancer plan is committed to making sure that we've got the staff where we need them, when we need them, and we're rebalancing cancer training places targeted at trusts in rural and coastal areas such as East Durham to improve patient outcomes.
Tim Farron.
Mr. Speaker, I welcome what the Minister has just said in response to my honourable friend's question, but we start a long way behind. The average in OECD countries is that 53% of people with cancer have access to radiotherapy. In England, it is 36%. In South Cumbria and Lancashire, the worst in the country, just 29%. It's no doubt in our communities in South Cumbria that is down to the fact that my patients in our communities have to travel 3-hour round trips to get treatment at Preston every day. Will she support the new plans we've got to bring a satellite radiotherapy unit to Kendal so that people in our communities can have shorter journeys and longer lives?
Minister.
I thank him for his question, and we share a part of that ICB because it covers my constituency as well. And this is why we've made a commitment in the cancer plan to make sure that coastal and rural areas are getting services that they need. It's why we're investing more in radiotherapy machines, and it's why we're working with ICBs to work with them to make sure that they're providing the services that are needed by their communities, and that we're supporting the recruitment of the cancer workforce necessary to be able to go into those particular rural areas as well.
Douglas McAllister.
Number 4, please, Mr. Speaker.
Thursday.
Thank you, Mr. Speaker. Cancer is the canary in the coal mine for the NHS. For far too many cancer patients, the NHS wasn't there for them when they needed it under the Tories. With Labour, an extra 213,000 patients have been diagnosed or received the all-clear on time. Lots done and lots more to do. That is why I pay tribute to the leadership of my honourable friend, the Minister for Primary Care and Prevention, and her National Cancer Plan. She's poured her heart and soul into that plan, all the while living with and being treated for cancer. We are investing an extra £2.3 billion in diagnostic capacity to deliver 9.5 million more tests by the end of this Parliament. Catching cancer earlier, treating it faster and preventing it in the first place is how we will save more lives.
McAllister.
Speaker, I welcome the focus of the National Cancer Plan on diagnosing cancer faster. This is needed across all cancers, but particularly with respect to leukaemia. Research by Leukaemia UK found that 1 in 4 patients face an avoidable delay in their diagnosis, and 37% of patients are diagnosed in an emergency setting. Can the Secretary of State set out how the implementation of the National Cancer Plan will address delays in diagnosing leukaemia, and what steps the Department will take to reduce the proportion of patients who are diagnosed through an emergency route?
Can I thank my honourable friend for raising this issue? He's absolutely right that leukaemia patients are disproportionately diagnosed too late. We're working with GPs so that they're better prepared to spot symptoms or concerning blood test results to cut out avoidable delays. But the real difference will come with the introduction of genomic testing at birth, allowing the NHS to leapfrog rare cancers like leukemia, so it can be caught early or even prevented in the first place. Lots done, certainly lots more to do.
James Wyle.
Thank you very much, Mr. Speaker. When I met with the Big C in Kings Lynn recently, I heard about the anxiety caused with only 52% of patients locally being treated within 2 months compared to a national average of 71.9%. What action is the Secretary of State's department taking to support the Queen Elizabeth Hospital Trust to improve its performance for patients?
The honourable gentleman is absolutely right. It's not just about diagnosis, it's also about faster access to treatment. We are meeting the faster diagnosis standard with performance at 77.4% in December 2025, and we're aiming to improve this to 80% by the end of March this year. We've got to go a lot further and a lot faster on the commencement of treatment. And while I will be very forthcoming and proud of the progress that we are making and the targets we are hitting, where we're falling short, and we're still falling far too short when it comes to access to cancer treatment, we'll acknowledge that, address it, and make sure we make more progress more quickly.
Number 5, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. Mental health issues affect all ages, and the support isn't always there. That's why we're determined to change that. We've hired almost 8,000 extra mental health workers since we came into office and increased investment in mental health by an additional £688 million this year. We're also transforming services through community-based 24/7 mental health centres, providing open access to treatment and support for adults with severe mental health needs, expanding NHS talking therapies and rolling out mental health support teams in more schools.
The work that the NHS is doing on this is absolutely vital, but can I draw the Minister's attention to Mind in Hackney, which is pioneering a new approach to make sure that within 2 weeks people get 2 sessions of mental health support, and then later on they can get more, but rather than waiting in a queue for 6 months for long-term support, they get that, and for very many people that is enough with a long-term treatment plan. Could I urge the Minister to come and have a visit? It's only half an hour up the road from Westminster. They fit it in before PMQs.
Depends on the traffic. Minister.
Very grateful to my honourable friend's invitation, and she's absolutely right. We do need to think of innovative ways of attacking the mental health issues that are facing our country, in particular our young people. That includes both digital and face-to-face therapies, both of which we're expanding at rapid pace, and I'm delighted to pass on her invitation to the appropriate Minister.
Sir Julian.
Has the Minister had any opportunity to form conclusions about whether or not excessive involvement with social media and other online potential harms has contributed to an apparent significant increase in the levels of mental health disorders?
Minister.
The honourable gentleman is right to highlight this very live issue at the moment. As a doctor, as a parent, as a minister, it is live on my mind as it is in the minds of honourable members across this House. It's important we follow the evidence. It's important we act safely and proportionately in terms of that evidence. And the honourable gentleman will know this government's ambition and direction that it wants to set in ensuring that young people are kept safe online.
3 seconds.
Thank you, Mr. Speaker. Analysis by Rethink Mental Illness of the latest NHS waiting time statistics shows that people are 8 times more likely to wait over 18 months for mental health treatment than for physical health treatment. Does the Minister agree with me that waiting 18 months for mental health treatment is totally unacceptable? And will the government set out what steps it will take to cut adult mental health waiting times?
Minister.
Very grateful to my honourable friend for that. And absolutely it is unacceptable that there is still a disparity between mental health and physical health when it comes to investigation, diagnosis and treatment. That's why this government is very proud to put in record amounts of funding into the NHS for mental health, and we're also making available £473 million of capital funding to encourage and establish 24/7 neighbourhood mental health centres alongside other capital priorities, so people can get the right support at the right time closer to home.
Ms Brown-Fuller.
After my young constituent was left in limbo between CAMS, health services and neurodevelopment pathways, with nobody claiming responsibility for her healthcare needs, her mum called 111 just to get some advice, and the advice was, if you're not happy with the service, contact your MP. With all mental health and emergency services absolutely stretched to breaking point, What tangible action can this government refer to that they're taking to address the mental health crisis in our neurodiverse population so that nobody else in my constituency has failed like this young lady?
Minister.
Mr Speaker, I think all of us are distressed to hear stories like this, and what motivates us to keep going and making sure that the NHS becomes a match-fit service for the 21st century. To reassure her, we are also, in addition to the other investments that I've highlighted today, investing £13 million to pilot enhanced training for staff so they can offer more support to young people with complex needs, such as those that she has described.
Question number 6, Mr Speaker.
Thank you, Mr Speaker. It should not be so difficult for women to get a diagnosis for a condition that every single one of us goes through. And that is why this government made a landmark step forward by including menopause in the NHS health check for the first time ever. And assessments for those eligible will benefit around 5 million women. But we're going further next year. Menopause will be one of the first conditions on a revolutionary new digital hospital NHS online.
I thank the Minister. Women in my constituency experiencing perimenopause and menopause symptoms tell me of a very, very varied experiences of going to their GPs, some excellent and some, frankly, alarmingly poor. And I was particularly concerned to hear from South Asian women of their experiences when they went with menopausal and perimenopausal symptoms. So what steps is the department taking to ensure that all GPs receive thorough and regular training that's appropriate to all London's communities?
Well, she makes an excellent and a very unfortunate point that many of us will absolutely recognise, that variability in service is something we need to address through things like the health check, through training that is being rolled out both by the GMC and by the Royal Colleges. We need to go further. There are some great examples in London across the country of multidisciplinary teams that are helping with that training, specialist services, things like menopause cafes to support women. We need to take those best examples to the rest of the NHS.
Speaker, HRT is a godsend for many women experiencing menopause, but there is a dire shortage of HRT implants, particularly those for women for whom other treatments don't work. These are unlicensed medicines, but they are absolutely essential for treatment, and there are women in my constituency who are suffering very badly, very poor mental and physical health impacts as a result. And I've exchanged a number of written questions with the Minister, especially the member for Glasgow South West. But we really want to know when action is going to be taken on this and when we can get the implants that these women so desperately need.
A member makes an important point about supply and availability across the country. That is something that we obviously monitor regularly and make sure that if there is a shortage, and if there's a shortage of particular medicine in a particular area, that there are alternatives available. We'll continue to keep that under review and make sure that women have the services and the medication that they need.
7, Mr Speaker.
Minister.
Thank you, Mr Speaker. With your permission, I will take questions 7 and 23 together. We know that dentistry was left in crisis by the party opposite, but this government is determined to ensure that everyone can access a dentist when they need one. We have recently broadened access to dental appointments so that patients with more serious and ongoing treatment no longer miss out. And between April and October 2025, we delivered 1.8 million more treatments compared to the same period before the general election.
Thank you, Mr Speaker, and I thank the Minister for his response. In the Buckingham and Bletchley constituency, I have a constituent who is waiting root canal and crown treatment to save her tooth, but she has been quoted NHS treatment at £400 with a 60% chance of success, but private healthcare at £1,300 with a 90% success rate. Hopefully the Minister agrees with me that this mismatch risks undermining confidence in NHS dentistry. So can he update the House on what steps he is taking to reform the NHS dental contract so that constituents like mine can receive timely and high quality care within financial reach?
Well, I was very sorry to hear about the plight of my honourable friend's constituent, and I'd be, of course, more than happy to look into the specifics of her case. The sad reality is that after 14 years of Tory neglect and incompetence, we have ended up with a two-tier dentistry system. This government is determined to ensure that high-quality NHS dentistry is available to everyone who needs it. The 2026 reforms that I announced on the 16th of December will help patients who have complex needs by creating a new care pathway backed by tariffs for dentists of between £250 and £700, which could save patients up to £225 in fees. So our 2026 measures, combined with long-term contract reform, will indeed enable timely, high-quality treatment that is within financial reach.
Thank you, Mr. Speaker. 14 years of Conservative rule has consequences for the children in my constituency. A quarter of them have tooth decay. The opposition can shake their heads as much as they like. This is the real-world impact of the decisions that you made. These children are some of the most deprived in Derbyshire. And the ICB found that they're more likely than the wealthier constituents 3 miles up the road to have tooth decay. Now, I am pleased that we are fixing dentistry. We're getting more urgent dentist appointments, and we've got the rollout of supervised toothbrushing in schools, but we need to do more. What more is this government doing to address this inequality and help children in my constituency that are in pain?
Well, I thank her for that question, and she's absolutely right. The Conservatives failed our children's health, with tooth decay the most common reason for hospital admissions for 5 to 9-year-olds, a truly shameful Dickensian state of affairs. We have provided Derbyshire County Council with £82,000 for this year's supervised toothbrushing programme, with further funding agreed till 28-29. I'm delighted that of the 42,000 increase in the number of treatments in Derby and Derbyshire ICB, 19,000 of these were for children, and by extending the soft drinks industry levy, we will protect kids' teeth from decay, a policy that's emblematic of the shift from treatment to prevention, which is at the heart of our 10-year plan.
Thank you, Mr. Speaker. My constituents continue to find it very difficult to get an appointment with an NHS dentist. Can the Minister outline what steps he is taking to encourage dentists in rural areas so that my constituents have access to an NHS dentist? He says 14.
I thank him for that question. I still do think, Mr. Speaker, we come to this chamber month in, month out for these oral questions, and we never hear an apology from the benches opposite for the mess that they left NHS dentistry in. For the party opposite, sorry really does seem to be the hardest word. With regard to the honourable gentleman's question, we have delivered 1.8 million additional appointments between April and October 25 compared to the same period before the general election. I would be happy to furnish him with the numbers precisely of how many more in his constituency and his ICB area have been provided. He can watch his postbox for that information.
Adrian Ramsey.
Thank you, Mr. Speaker. On urgent dental appointments, the Daily Mirror reports that of the nearly 1 million appointments that have been commissioned by integrated care boards since April, 900,000 have not been taken up because of strict rules around the scope of treatment. Meanwhile, in my constituency of Waveney Valley and around the country, too many people are going without the treatment that they need. Could the Minister update on when the Government expects to meet its targets on urgent appointments?
Well, I thank him for that question. Our manifesto commitment was about improving access to urgent dental care. That's precisely what we've done by commissioning hundreds of thousands of additional urgent treatments. It became clear as we were working through that process that the clinical definition was too narrow and out of step with a common sense interpretation. So we acted on the advice of the Chief Dental Officer. We broadened the definition. From this April, urgent care will be embedded in the contract, and of course we continue to work with the sector on long-term contract reform.
Helen Morgan, Liberal Democrat spokesperson.
Thank you very much, Mr. Speaker. Everyone in this House knows that NHS dentistry was allowed to fall apart under the Conservatives. From DIY tooth extractions to people forcing to go to A&E because they're in pain, and children are suffering in every corner of the country. Last year, 38,000 children in Shropshire didn't see a dentist. In Surrey, that number was 100,000, and in Sussex, 133,000. It's a disgrace. Now, the government promised an extra 700,000 urgent appointments to fight this crisis, but it looks set to have been broken in the previous year. Can the Minister today highlight in black and white how many extra urgent appointments were actually delivered last year rather than simply commissioned?
Minister.
Well, I thank her for that question, and as I just pointed out to the gentleman opposite, we've broadened the definition because the clinical definition of urgent was simply not in line with the common sense interpretation. So we were having people removing their own teeth through DIY dentistry who were not fitting into the classification of urgent. So we've changed that categorisation. As a result of that, I'm very pleased to confirm that we have delivered 1.8 million additional appointments and treatments this year compared to the same period last year, that is April to October 2025. And we will continue to work on that basis of embedding urgent care into the contract as per what I announced on the 16th of December with the 2026 reforms that we are carrying out.
Trina Brackenwood.
Thank you. Question 8, Mr Speaker.
Minister.
Thank you, Mr Speaker. We've now got ambulances arriving faster, but we know there is much more to do. We've taken action to reduce handover delays by introducing release to rescue 45-minute handovers, supporting ambulances back onto the road to respond to patients faster, and we've invested in an extra 500 ambulances. And I'm pleased to announce that as a result of this government's investment in modernisation, West Midlands ambulances are reaching patients with conditions like suspected heart attacks and strokes almost 7 minutes faster this winter than last winter.
Mr Speaker, I also thank the Minister for her update. I welcome the progress made with ambulance response times and also handovers. I recently visited Willenhall Ambulance Hub to thank the incredible staff and to hear about winter pressures, local handover delays and the strain of late finishes on their family life and childcare. Can the Minister outline what action is being taken to tackle systemic bottlenecks in A&E departments, high bed occupancy and pharmacy delays to protect staff wellbeing and ensure high patient quality care?
Minister.
Thank you. And can I commend her for visiting her ambulance service to understand the pressures that they're working on? I think many honourable members do, and it is a really useful visit to understand those wider issues, as she says. She raised an important point about handover delays impacting staff as well as patients, but reducing these delays will ensure that staff are no longer stuck outside emergency departments. On the wider issue about the front door, NHS England's Model ED will set out core principles and pathways for high-performing emergency departments, which will improve patient experience and flow with lower waiting times and less overcrowding. And we're committed to improving rest facilities to support staff wellbeing.
Maguire.
Mr Speaker, in November I joined a local ambulance crew and saw firsthand the great work that they do for our community, but services are under huge strain. So will the Minister designate ambulance stations as critical infrastructure to protect them from closure and set up an emergency fund to support them?
Natalie.
Again, I commend her for going out with her particular crews. One of the issues with why we've been so successful this year in improving the services is because of looking at things like where ambulances are located and how they are operationalising their services. We'll continue to work with NHS England on the best model for local constituencies.
Lucy Collins.
Mr Speaker.
Minister.
Thank you, Mr Speaker. We inherited a broken NHS dental system with many people unable to access a dentist when they need one, including in my honourable friend's constituency. But we're making real progress, having increased the number of NHS treatments by 1.8 million between April and October 2025 compared to the same period before the general election. As a result of this nationwide increase, I'm pleased to report that 89,000 more NHS dental treatments were delivered between April and October last year in Lancashire and South Cumbria ICB area, which of course includes my honourable friend's constituency.
Lucy Collins.
Thank you, Mr Speaker. Mr Speaker, one of my constituents contacted me because their spouse is bedbound and he can't get dental care at home. So he gets no routine care and he recently waited 3 months for an emergency extraction, something he could have had on the same day if he'd not been disabled. So can the Minister tell me what work is happening to help my constituents access the care that they need?
Minister.
Yeah, I thank her for that question. I'm really sorry to hear about the plight of her constituent. And I'd, of course, be more than happy to meet with her and perhaps and to look into the specifics of the case. Specialised dental services have a vitally important role to play in providing dental treatment to vulnerable people in settings such as care homes. I think in many cases this is about teamwork and integration, making sure that primary dental care is working in lockstep with adult social care, and there is clearly some room for improvement in some areas, and I'd be happy to work with her on ensuring that this issue gets resolved.
Nad Shah.
Question number 10, please, Mr.
Minister.
Thank you, Mr Speaker. The 10-year health plan announced ambitious measures to make the healthy choice the easy choice, and this includes tackling the obesity epidemic through mandatory healthy food sales reporting, business targets to increase the healthiness of products sold, and restrictions on junk food advertising.
Shah.
Thank you, Mr Speaker. Can I thank the Minister for that? In Bradford West, more than 1 in 5 children begin primary school overweight or obese, and by the time they leave primary school, that figure rises to 1 in 3 children. Can the Minister set out how this government's world-leading new ban on junk food advertising will help parents to give every child the best and healthiest start in life?
Minister.
I thank my honourable friend for outlining the very real crisis that we have in terms of childhood obesity, and it's a problem that robs children of the best possible start in life and sets them up for a whole lifetime of health problems. It's why this government has come down hard and delivered our commitment to restrict advertisements for junk food on TV and online. This action will remove around 7.2 billion calories from children's diets every single year.
Mr Speaker, as the House will know, pharmacies are an important part of the system to prevent ill health. Last week I raised the challenges that pharmacies in my constituency of South West Hertfordshire and across the country are facing due to rising costs and a lack of funding support. Having written to the Minister for Care in April of last year and followed up several times since, could the Minister advise how I can arrange a meeting with him to discuss these concerns further?
Minister.
I thank the honourable member for his question. The Minister responsible runs a regular ministerial surgery and will be more than happy to meet with you.
Minister, Shadow Minister Dr Caroline Johnson.
Thank you, Mr Speaker, and I declare my interest as a consultant paediatrician in the NHS. Mr Speaker, prevention of ill health is crucial. It's particularly important in children, and perhaps most especially when one is trying to prevent ill health being caused to children by doctors. I've expressed concerns previously about the puberty blockers trial. Many in both houses have too. The trial has now been paused due to an MHRI letter. So, when were ministers first aware of that letter, and when were they first aware of the concerns described within it?
Minister.
Thank you for a question. The regulators are doing their job. This is a perfectly ordinary occurrence in terms of certain research trials. They have paused, as she's made the House aware, and I'm sure the House is already aware, but we will leave the regulators and the clinicians who are doing their job to make sure that all the trials, including this one, are done in an appropriate fashion.
Caroline Johnson.
Thank you, Mr Speaker. That's a very interesting answer. Before this Christmas, the Secretary of State had confidence in an allegedly vigorous and rigorous process. But fertility preservation techniques have not deteriorated over the last few months. The age at which children reach each standard stage of puberty haven't changed over the last few months. But the MHRA's view has. Why? Given that this is such a scrutinised trial, does this not call into question the MHRA's wider competence and due diligence? And will she publish the letter from November from the MHRA referred to into the more recent correspondence that they published on Friday?
So what she highlights is part of this rigorous process. That's what happens. Why the MHRA have changed is a question for the MHRA, but it is up to them to raise these issues through the process, and this is why we run such trials. It's an independent regulator.
Colin Miller.
Question 11, please, Mr. Speaker.
Stay.
Thank you, Mr. Speaker. The Prime Minister has made tackling violence against women and girls a priority across this government, and every public service must play our part. In the NHS, we'll be supporting GPs to identify, support and refer victims and survivors into specialist services. This will include a specialist support worker every GP practice can draw on, and training GPs to spot the signs of domestic abuse and sexual violence. As part of the government's VORG strategy, Health will provide an additional £5 million for victim support services and up to £50 million to roll out specialist services for child sexual abuse victims.
Thank you, Mr. Speaker. I'm grateful to the Secretary of State for that answer. I recently had the opportunity to visit the dedicated staff at Survivor Space a centre for the victims of sexual violence in Oxford that serves my constituents. There I was shocked to learn that victims and survivors of sexual violence may wait up to 2 years for a counselling session, and further appalled to learn that at least one had been advised they could not access NHS mental health services until they had first had counselling from Survivor Space. So does the Secretary of State agree with me that no survivor should have to wait 2 years for this treatment? And would he or one of the ministers meet with me and representatives from Survivor Space to discuss how this dedicated healthcare funding can get to the front line and support these critical services?
I wholeheartedly agree with the honourable members, and I would say two things in response to the point he raises. Firstly, the voluntary and community sector does and should continue to provide support for victims. The voluntary sector does a brilliant job. They often do it in an environment that feels safer and more inclusive, and we should welcome that. But the existence of voluntary sector provision does not excuse the NHS from performing its duties. And one of the changes that I have led in the culture of the leadership of my department is to recognise that when it comes to investing in NHS services for victims and survivors, those are NHS and DHSE responsibilities, not Home Office, not MOJ or others. We have to take responsibility for meeting the needs of everyone. There is, of course, more to do specifically on waiting times, and I'll be delighted to make sure that he gets the meeting asked for.
Dr Becky Cooper.
Question 12, please, Mr Speaker.
Minister.
Thank you, Mr Speaker. We're revolutionising our country's health and wellbeing through our 10-year health plan, delivering the 3 major shifts, boosting life expectancy and improving mental health for everyone everywhere. And we're shifting from prioritising tackling sickness to prevention, including through action to create a smoke-free generation via the Tobacco and Vapes Bill.
Thank you, Mr Speaker. And it's great to hear that wellbeing is being built in through the shift to prevention in our National Health Strategy. Would the Minister agree with me that we should now champion health in all policies, starting with the mandatory use of the wellbeing indicators available for the Treasury Green Book, currently used sporadically at best?
Well, I thank my honourable friend for her question. My honourable friend will know that that is a decision, a question for Treasury colleagues. But, of course, this government is a mission-led government and is committed to healthy outcomes across government, not just in the DHSC.
Joe Robertson.
Thank you, Mr Speaker. The Secretary of State for Health has compared GP salaries to that of the Prime Minister. Now, I can understand why the Health Secretary is taking a keen interest in how much a Prime Minister gets paid. But can the government assure this House that the GP contract will see an increase in GP funding over and above their inflationary pressures, because they are on the front line of ensuring national wellbeing indicators in this country improve?
Just about scrape something together, Minister.
I'm not entirely sure what any of that question had to do with wellbeing indicators, but fair enough.
No, just a minute. Just say, let me do my job, I'll let you do yours. You try and answer it. I did put that caveat on at the end.
Sorry, I didn't hear you. Thank you, Mr Speaker. And I can confirm that my honourable friend, the Minister responsible, will be laying a written ministerial statement at 4 o'clock today, where the contract for 26-27 will be laid out.
Dr Elpington.
Question 13, Mr Speaker.
Marvellous. Minister.
Mr Speaker, every child with a disability should have the opportunity to reap the health and well-being benefits of being active. We are working across health, education and sports to break down barriers to physical activity, including for children with Down syndrome. This includes making sure they have access to inclusive, sensory-rich activities they can enjoy with friends, family and carers.
Dr Elpington.
Grateful to the Minister's answer. I recently had a meeting with British Gymnastics, the Stepping Stone charity, and Prime Acrobatics, a wonderful and inclusive gymnastics centre in my Surrey Heath constituency, who told me that young people with Down syndrome are routinely prevented from taking part in physical activity and sport because of concerns about neck stability. And I wondered if the Minister might be willing to take this case on, to work with GPs, the NHS and relevant bodies to review the guidance that guides that area, and to remove some of the barriers that too often prevents young people from engaging with the physical and sporting activities that are so vital to their physical and mental well-being.
Minister.
I'm very grateful to the honourable member for raising that point. He's not the first member to have raised that specific issue. Clearly, patient safety and child safety is paramount, but I think it must be proportionate and led by evidence, and I'm very happy to explore this further with him.
Question number 14, Mr Speaker.
Minister.
Mr Speaker, I'm grateful to the Honourable Lady, my honourable friend, for her work on raising the profile of this underserved area. It is simply unacceptable that disabled women are at a higher risk of neonatal and perinatal mortality and stillbirth, and that they continue to experience adverse outcomes relative to the general population. That's why my right honourable friend, the Secretary of State, has launched an independent maternity investigation that will help us understand the systemic issues behind why so many families, including disabled women, experience unacceptable care.
Richard.
Thank you, Mr Speaker. Too often disabled women's bodies are deemed not to count. In the last year, I've met two incredible disabled women, Carly, a Paralympiad, and Sarah, an occupational therapist. Neither found out that they were pregnant until their second and third trimesters, respectively, because none of their clinicians considered that they might be pregnant. Wow. But we are making babies, Mr Speaker. We are having babies and we are being brilliant mothers. Against the odds. Odds which mean we have a 44% higher likelihood of stillbirth. Will the Secretary of State meet with me to discuss ensuring inclusive maternity care for disabled women is at the heart of our women's health strategy so that our womanhood is no longer invisible?
Mr Speaker, we are so lucky to have my honourable friend in this place challenging us to be better, and we can be better. We need to be bolder and take decisive action to close the gap on inequalities to ensure all women receive safe, personalised and compassionate care. We know how important inclusive maternity care is for disabled women. I know she has previously had meetings with my honourable friend, the Minister for Maternity, and my right honourable friend, the Secretary of State, will be delighted to meet her.
Josh Babrin.
Thank you, Mr Speaker. A matter of weeks ago, a power cut at Eastbourne District General Hospital, where I was born, plunged parts of the hospital into darkness and forced our maternity unit to temporarily close, particularly affecting disabled women. People had to use their phones, their iPhone torches, to be able to see. And despite this power infrastructure failure, we are way at the back of the queue for new hospital funding. So will the Minister commit to accelerating the unlocking of that cash earlier?
Order.
Women can have the services they deserve.
We have had this question before about trying to drag a question to something that's not relevant to the main question. We'll now come to the Minister. Shadow Minister, can I welcome him to his first time at the dispatch box? Gregory Stafford.
Thank you very much, Mr Speaker. 7 months ago, the NHS 10-year plan promised a maternity task force. Can I ask the Minister how many times it's met?
Minister.
Can I welcome the honourable gentleman to his place? I'm informed by my right honourable friend it has not met yet, but we're establishing it and we will be meeting soon.
Gregory Stafford.
Thank you very much, Mr Speaker. And the fact that the task force has not even met 7 months later tells us everything we need to know about the urgency and the importance that's been shown by this government on this. But, Mr Speaker, in Leeds, families are losing faith in the failing maternity services. The Secretary of State has said that, and I quote, he takes this extremely seriously. Yet Donna Ockenden, who exposed the failings in Nottingham and has the support of families, and who has said that she is ready and willing to lead the inquiry, has not been appointed. If he and the Secretary of State takes this extremely seriously, why have they not appointed a chair yet?
Minister.
I see the honourable gentleman has had his brass neck from his predecessor transplanted to him. He talks about 7 months. What about the last 14 years through which that party opposite presided over decay and decline of our NHS, failing our patients and failing the clinicians that serve them? My right honourable friend, the Secretary of State, is in regular contact with maternity families. He knows, as well as I do, he takes the matter extremely seriously, and he will be reporting to this House on a regular basis regarding the outcome of his deliberations.
Number 15, please, Mr Speaker.
Thank you. Through our 10-year health plan and the shift from hospital to community, our new neighbourhood health service will benefit millions. It's underpinned by 120 new neighbourhood health centres by 2030, alongside the supercharging of community diagnostic centres, now to deliver faster, more accessible care with over 100 sites open 12 hours a day, 7 days a week. This massive expansion will transform community access for millions of patients, regardless of postcode.
Thank you, Mr Speaker. I'm delighted to hear the Minister's response. Zachary Merton Hospital in Rustington was closed on a temporary basis. That closure became permanent and the site is being progressed for disposal.
In Rustington, over half of residents are elderly and rely on intermediate and step-down care. They have not been consulted on the permanent closure, despite assurances from Sussex Community NHS Foundation Trust and NHS Sussex ICB. Would the Secretary of State or the Minister confirm whether he considers this a substantial variation in NHS services, and will he consider exercising his call-in powers before the site is irreversibly sold?
I thank her for that question. I'm not familiar with the details of the case she's just mentioned, and if she would perhaps write to me, I'd be more than happy to take the issue up. These are, of course, matters that are determined by the ICBs and the trusts in each case, and this government's not in the business of micromanaging what's happening out there in the field. We believe that people who are closest to our citizens are the best people to be taking those decisions. However, we do expect the right outcomes, and I'd be happy to work with her on that.
Women with the painful and incurable condition of endometriosis have suffered stigma and ill health for far too long. Despite impacting 1 in 10 women, it takes on average over 8 years for a diagnosis. So will the Minister make sure in the new Women's Health Strategy that it has stronger training, better awareness and faster support for women?
I thank her for that question, and it's an absolutely vital issue. Endometriosis is a really serious challenge for so many women across our country. I can confirm that it is indeed an integral part of the strategy, and I'm sure that she will be pleased to see the outcome of that strategy as it moves forward.
Question number 16, Mr. Speaker.
Minister.
Mr Speaker, the Health PFI programme between 1992 and 2015 delivered 126 new acute facilities for the NHS, delivered over £12 billion of investment in the estate. NHS PFI contracts are held by individual trusts, and NISTA publish annual data on them, including the costs of all those PFI projects. The last PFI contract was signed in 2015. We are not bringing back PFI. We're bringing forward a new PPP model, which will draw on lessons learned from the past to ensure we deliver our commitments of a 10-year plan.
Mr. Speaker, Alderley Children's Hospital and NHS Foundation Trust in my constituency, Liverpool West Derby, faces significant financial pressure due to its private finance initiative deal. This is because over 50% of its total PFI payment is going towards interest charges, with Alderley still owing £380 million by 2045 for the PFI investment of £189 million. Mr. Speaker, that's nearly £200 million being drained out of Alderley over the next 2 decades because of the now discredited system of PFI that should be spent on making sick children better. So can I ask the Minister what assessment the Department has made on the potential impacts of the use of PFI to fund the recently announced neighbourhood health centres?
He highlights an important one where something is not going well, clearly, and the team, the Department of Health, are working with the team at Alder to help with rectifying some of those problems. That is why we will not be using that model of PFI in future models. Those are the lessons that we have learnt, and we will take forward a new model of PPP for our neighbourhood health service, which will transform care for people in his constituency and across the country.
Harriet Cross in Topicals.
Number 1, please, Mr. Speaker.
Thank you, Mr. Speaker. Today we're publishing a new GP contract. Backed by new funding, it will recruit more GPs and cut waiting times for appointments. The changes and modernisation will diagnose thousands more cases of lung cancer, protect children by boosting vaccination rates, and provide more people with weight loss jabs on the NHS. This follows an extra £1.1 billion we've invested in general practice this year and builds on the 2,000 more GPs we recruited since the general election. Mr. Speaker, after 14 years of decline, the government is fixing the front door to the NHS, bringing back the family doctor, ending the 8 a.m. scramble. Lots done, lots more to do.
Harriet Cross.
Medical practice in my Gordon and Buchan constituency saw its national insurance bill rise by £75,000 thanks to this government. That has put huge pressure on the practice, which was already operating at 1 GP for 3,000 patients, 3 times higher than what the BMA recommends. When did the Secretary of State last meet the Chancellor to discuss the impact of the next rise on GP practices, and what is he and his department doing about the pressure?
We are on top.
Mr. Speaker, I see the Chancellor most weeks. And that is why we have got record investment going into our NHS, which is improving patient satisfaction with access to general practice, cutting waiting lists, improving ambulance response times, all to fix the mess they left behind. And people should be in no doubt. Given the chance, they would do it again. They oppose the investment, they oppose the reform, they can never be trusted with our NHS.
Mr. Speaker, I welcome the changes under the Gambling White Paper for the responsibilities for the Department on the treatment and prevention of gambling harms. As part of these new responsibilities, will the Secretary of State undertake to committing a review of the impact of gambling, advertising, marketing and sponsorship on public health, including the health and well-being of children and young people?
Minister. Thank my honourable friend for his question. We acknowledge the important issue of the potential negative impact that gambling advertising may have on children and young people's health. My officials continue to work very closely with officials at the Department for Culture, Media and Sport, and I'll be discussing this issue with the Minister for Gambling, who is responsible for gambling advertising policy. We continue to keep the public health evidence under review and consider suitable action to protect individuals and communities from gambling harms.
Andrew, Shadow Secretary of State.
Thank you, Mr. Speaker. In the Plan for Change, the Government committed to meet the 18-week standard for routine operations, and latest data suggests the Government is not on track to meet this commitment by the end of the Parliament. In December, less people were treated within 18 weeks than the previous month. So will the Secretary of State now accept the reality that patients are seeing and, as the IFS have warned, the Government will not deliver its commitment on its key milestone to deliver the 18-week standard?
Mr. Speaker, I will never surrender to the tyranny of low expectations of the party opposite. We have cut waiting lists by 330,000 since we came to office, and waiting lists are now at their lowest level in 3 years. We made progress despite strikes, we made progress despite winter pressures, and we've made progress despite every bit of investment and modernisation has been opposed by the party opposite. Instead of criticising our record, he should apologise for his.
Stuart Andrew.
Another leadership ambition, I see. Mr. Speaker, on the 29th of September, I wrote to the Secretary of State regarding the late Dr. Susan McAllis's campaign for better research into lobular breast cancer. Sadly, to date, I still haven't had a reply. She established the Moonshot Project, and the last government committed to support its aims. However, despite meeting the Secretary of State, the projects say they still have no clarity on how the project and research will be expedited. So can the Secretary of State confirm now government approval for the funding required for this critical research for so many women in this country?
Well, firstly, Mr. Speaker, can I apologise to the Shadow Secretary of State for not having replied to his letter? Let me make sure I do that. The second thing, on the substance of the issue, where there is no disagreement across the House, I'm absolutely supportive of and wanting to fund this research. We've got to make sure that the research proposal meets the standards and has the confidence of our funders. I want to make sure, and we are working with the team to try and get it over the line, but that's the only obstacle here. It's certainly not a political decision.
Good step back.
Speaker, many people in Falkirk face barriers accessing treatment because they're juggling often contradictory bits of paper regarding appointments across different health boards. What assessment has the Minister made of this Government's NHS digital transformation strategy for improving treatment compared to the strategy being pursued for healthcare available to my constituents by the Scottish Government?
Mr. Speaker, this UK Labour Government at least is spending billions of pounds upgrading the digital architecture of the NHS in England. This means now that over 90% of GPs offer appointments online, and by 2029 we'll have a single patient record for patients and their clinicians to access all of their information. Contrast this with the digital desert that exists in Scotland, and that's why it's time for Analogue John to move over and make way for Anna Sarwar as First Minister to save Scotland's NHS.
Thank you, Mr. Speaker. Earlier this month I joined South West Ambulance Service for a shift, which was an incredibly humbling experience. At the hospital, I met paramedic science students who told me that it's almost impossible for them to get a job. Only 8 of the last year's 120 paramedic science students actually got a job. Universities assure students they can definitely get employment as a graduate, but the ambulance services have a massive pool, 200 in my local case. So I just wondered what it is, and they haven't advertised a single job in the last 6 months. What's the Minister going to do to actually make sure that this amazing career is a reality?
The honourable member highlights a real challenge we've inherited of the disconnection between undergraduate education and training and then the jobs that are available. We are addressing that with the work we're doing on the workforce plan. I do want to place on record my thanks to South West Ambulance Service. In December, they improved ambulance response times by just under 30 minutes for Category 2. There are still big challenges in the South West, but I think that team deserves real credit for the improvement they've led.
Sarah Edwards.
Forced to travel to Burton, Derby, Sutton, Coldfield for their NHS treatment that can't be provided at the local community diagnostic centre, and some travel up to 30 miles for chemotherapy with little or no public transport. So could I ask what the Secretary of State is doing to deliver healthcare investment locally and also to improve the transport links between NHS sites so that those who need to use it can get to their treatment?
Minister.
The Honourable Lady highlights an important point about the need to have further rollouts of CDCs, particularly for her sorts of communities. We're expanding those, we're expanding the time available for them. We're also expanding access through the front door through the NHS app and through digital, and our new online hospital service will also improve the sorts of issues she meant so that we bring services closer to her patients and not expect them to have to travel.
Thank you, Mr. Speaker. Last Friday, a doctor came to my surgery and produced a letter that he and around 100 other doctors and consultants from Grimsby Hospital had sent to the then interim chair, concerned about a rundown of services at Grimsby and Scunthorpe hospitals and a further concentration on Hull. This is made worse by a series of interim chief execs and chairs. Could the Minister give an assurance that Grimsby and Scunthorpe hospitals will not see any rundown in the services?
Minister.
I understand the issues that he and many other members have raised in the Grimsby, my friend for Grimsby, and other areas in the Lincolnshire area. It is important that the clinical mapping for their new services are supported by clinicians and by local people, and I'm happy to continue to talk to him and others about the progress with that. I'm in touch with the NHS England team, and they assure me that they are continuing to do that. I understand also the difficulties of
in 2024, my constituent Wendy fractured 3 vertebrae from osteoporosis after being denied a DEXA scan, spending 3 months in hospital and suffering lasting harm. Will the Minister review DEXA eligibility and expand local access to prevent future fractures and save the NHS costs?
He makes a really important point about DEXA scans, how important they are for osteoporosis, particularly for women. We have already expanded the DEXA scans across the country this year. We have also allocated more capital funding for such a capital investment, and we will be announcing the allocations in due course.
Taylor.
Thank you, Mr. Speaker. Cancer services are due to move from Royal Marsden to the Evelina Hospital next year. Concerns have been raised with me about the provision of a teaching space for children who are undergoing cancer treatment and its provision in the new plans. So will the Minister meet with me to discuss that transition and confirm that the Department of Health and Social Care is working with the Department for Education to ensure a high-quality hospital school is provided at both sites during the transition?
Mr. Secretary.
I thank him for his question. As he's probably aware, the cancer plan, this government's cancer plan, which I launched just over a week ago, is the first ever cancer plan to have a section on children and young people with cancer and to commit to supporting children holistically throughout their cancer journey. I'd be more than happy to have a conversation with him about the issues that he's raised.
Mr. Speaker, a resident in my Carlisle constituency was initially told to take a round trip of almost 200 miles to receive hospital treatment in Glasgow because he was registered with his nearest GP, which just happened to be in Scotland. Can the Minister tell the House what progress is being made in reviewing and updating cross-border healthcare guidance?
Thank you, Mr. Speaker. Well, Glasgow's a great place to get medical care. I can attest to that. But you shouldn't have to travel 200 miles to get medical care. The Honourable Lady and I have had many discussions on this topic. I'm very glad to continue those discussions. She knows that treatment along the border is subject to service level agreements in both English trusts and Scottish health boards, but it should be much more porous and much more accommodating than it is, and I'm happy to take these discussions with her further later.
Speaker, Catherine from Redbourne says that she has to wait weeks for a GP appointment, and yet her village is facing up to 70% increase, so that's thousands of new patients, and some of that speculative development. So does the Minister agree that council should have the powers to ensure that planning approvals are dependent on first securing healthcare to serve those new residents, and will the Minister commit to ensuring that NHS planning cycles are aligned with this housing development to ensure communities don't have to wait weeks, months or years?
Well, I thank her for that question. On the subject of GP access, I'm delighted that 75% of patients now say it's easy to contact their GP, a sizable 14 percentage points increase since July 2024. Really positive development that I'm sure the Honourable Lady would want to welcome. With regard to planning, of course, it's very important that you've got the ICB and the Council and the developers joined up together. We need to make sure that happens. There's also the Primary Care Utilisation Fund, which her constituents may be interested in.
Thank you, Mr. Speaker. I'm delighted that 2 mental health support teams are already at work in Bracknell Forest, supporting almost 4/5 of local pupils with timely, targeted mental health support. There's a lot more to do to fix the CAM system, but could the Minister set out how school-based interventions are beginning to deliver change?
Minister.
Mr. Speaker, mental health support teams provide innovative early support for children and young people in schools and colleges, and I'm pleased these are working well in Bracknell Forest too. Up to 900,000 additional pupils will have access by this spring, and we're accelerating the rollout to reach full national coverage by 2029.
Thomas.
Thank you, Mr. Speaker. Several weeks ago, I received a jaw-dropping email from a local Bromsgrove GP who told me that a 10-month-old child nearly died after ambulance delays. But worse, the same day, another patient, a 66-year-old driving instructor, suffered a cardiac arrest on a driving lesson. He died whilst being driven to the hospital by his wife. My constituents demand a better service, better response times, Mr. Speaker. What is the government going to do about this? And will the Secretary of State meet with me and the concerned GP who wrote to me to address this issue?
Secretary of State.
Mr. Speaker, nothing is more sobering than hearing the experiences of what happens and the life and death difference of the NHS being there for people when they need it and not being there when they need it. And people be aware of a tragic case over the weekend involving a woman in her 90s in the Isle of Wight, which we are looking into. Ambulance response times are improving, but I would not pretend that they are good enough. We've done a lot, there is a lot more to do, and he has painfully and powerfully underscored what happens when the NHS is not there for people when they need it. That's the NHS we inherited, and that's the NHS that I'm determined to change.
A&E's closure was accompanied by a commitment to a 24-hour UTC, a commitment the trusts are now breaking. Can the Minister meet with me to discuss how local services can be preserved and improved?
Minister.
I'm happy to discuss that particular issue with him. We are determined to have co-located UTCs. I know that's a matter for the local commissioner, but I'm happy to talk about it further.
Shuka Adam.
Mr. Speaker, Vista is a 160-year-old charity serving the people of Leicester and Leicestershire suffering from visual disabilities. Last year alone, it served 21,000 people. Sadly, Vista is imminently going to be closed down if it cannot raise £2 million by the end of March. If it does so, the devastating effect on the National Health Service and the Social Care Service will be unimaginable. So will the Minister meet with me and other local MPs and representatives of the University Hospital of Leicester to discuss what we can do to save Vista?
Minister.
I thank him for that question. I pay tribute to Vista for the outstanding work that it's doing. Improving IT connectivity, of course, is a vital part of what we're doing, and the single point of access project is of relevance in that context. I'd be more than happy if he were to write to me and we could look at the particular issue that he's raising.
Mr. Speaker, in Rochdale, we need more midwives to provide the safe staffing levels that our mums-to-be rightly expect. But newly qualified student midwives are often finding that it's difficult to find jobs when they qualify. So can the Minister explain exactly when the NHS workforce plan is due so they can give reassurance to these newly qualified midwives that they've got a career in the NHS that's actually going to...
Secretary of State.
I'm grateful to my honourable friend for raising this issue. The NHS workforce plan will be published in spring. I recognise the challenge he sets out. We're determined to address it. We desperately need more midwives, and we certainly need good clinical leadership in this area, and that's what the government's working to.
George.
Mr. Speaker. Minor injuries units are being phased out and urgent treatment centres like the brilliant one West Cornwall Hospital in my constituency had its hours cut under the Conservatives and those have not been restored. This clearly helps to take the pressure off ambulance and emergency services. So what will ministers do to ensure that those services are reinforced rather than reduced?
So say.
Well, Mr. Speaker, one of the rationales for both the 10-year plan but also the medium-term planning that we're doing across the NHS is to ensure better integration with the principle of people receiving the right care in the right place at the right time. Decisions about local configurations are obviously matters for local leaders, but we keep these things under review, and if he has concerns, he should certainly write to us.
Final question, Leila McAvoy.
Thank you, Mr. Speaker. As the Secretary of State knows, Darlington Memorial Hospital is part of CDTFT, which recently has been marred by a scandal of over-operation in our breast services. We know that many women came to harm as a result of these failures, but we are yet to find out how many women and the full extent of the harm because the Trust have not completed the comprehensive look-back. Will the Minister meet with me to ensure that our Trust has all the resources they need to learn the lessons necessary to ensure that no women in my area or in the country have invasive and painful clinical procedures that they don't need?
Minister.
Mr. Speaker, my honourable friend and I have had discussions regarding this matter before. I'm happy to meet her to discuss this further. Patient safety is of paramount importance, especially when it comes to surgery and breast surgery, and I'm happy to meet her at a ministerial surgery.
Just let the front bench change over. Yeah, go for it. Right, point of order, Louise Sanders-Jones.
Thank you. On a point of order, Mr. Speaker, I would like to correct the record in relation to something I said during the last defence orals. On the 2nd of February 2026, I said the Prime Minister did not work with any of Phil Shiner's organisations and his role was limited to working with the Law Society on points of law. However, since then, it has been brought to my attention that in 2006, the Prime Minister was instructed to represent an individual by the law firm for which Mr. Shiner was the principal solicitor. So I would like to take this earliest opportunity to apologise to the House and correct the record.
Very I thank the Honourable Member for a point of order and for placing her correction on the record. We now come to further point of order.
I'm not giving you prior notice, Mr. Speaker, but during health questions just now, the Health Minister said that for the first time ever there will be a children's cancer strategy as part of a cancer strategy. However, the government scrapped the children's cancer strategy that we had put in place. So should the Minister not come and correct the record for having misled the House?
First of all, it's not a point of order, and the fact is we're going to carry on the debate, but it's not for me to accept whether it was right or wrong. But what I would say is you've certainly got the point of order. I'm sorry we didn't get any questions, Madam Secretary, the point of order. Right, let us come to the presentation of the bill. Mira Wilson.
Online Services Age Restrictions Bill.
Second reading what day?
Monday the 9th of March.
Monday the 9th of March. Thank you, Manira. Right, we now come to the 10-minute rule motion. Esther McBeck.
Mr. Speaker, I beg to move that leave be given to bring in a bill to introduce compulsory labelling of halal and kosher meat and products containing halal and kosher meat and for connected purposes. Mr. Speaker, this is a bill about animal welfare, transparency in meat production and consumer choice. It does not seek to ban halal or kosher meat, it seeks to ensure they are clearly labelled. It is important consumers have such information so they can make an informed choice about what they are buying. And currently, consumers do not have that information, and many are purchasing and consuming halal and kosher meat without their knowledge and without their agreement. The unique process of halal and kosher meat requires the animal to have its throat slit. In the case of halal meat, the animal is often stunned before it's killed, although it might not be, and for the shahita killing, for kosher meat, there is no pre-stunning. This lack of stunning causes the animal to experience severe pain. An individual concerned about animal welfare would want to know if an animal has been stunned prior to slaughter. Likewise, there are many religious groups who want to know what they are consuming too, and if meat has been blessed by another religion. In all these cases, clear labelling is essential to make an informed choice. Currently, the legislation that regulates animal slaughter is set out in assimilated EU Regulation 1099/2009 on the protection of animals at the time of killing, as well as in the welfare of animals at the time of killing, England Regulations 2015. Under these laws, animals must be stunned before killing, but exemptions exist for killing without stunning, in accordance with specific religious rites. Added to that, there are currently no requirements for such meat to be labelled. And what was once an exemption to the accepted stunning process of animals has become a growing part of the UK's meat market. The government's own figures show that of the 1.035 billion animals processed in English and Welsh slaughterhouses in 2024, an estimated 214.6 million were slaughtered to produce halal meat. The analysis shows the total meat supplied by non-stun slaughter is about 4 times greater than the population of Muslims and Jews in the UK. So while government guidance is clear that non-stun slaughter must be intended for consumption by Jews or Muslims, production is clearly going way beyond that. So much so, the UK is now exporting halal meat abroad. Between 2018 and 19, there was an almost 700% increase in the volume of sheep meat exported to the UEA, all of which is required to be halal. Clearly, without compulsory labelling of non-stun meat, slaughterhouses have gone down the route of producing more of it. In effect, a two-tier system has been created, one in which some slaughterhouses comply by stunning laws and one in which others don't, citing the religious exemption, without ever intending to focus their sale on that market. Unfortunately, a driver of this market of non-stun meat is that a step of the process is removed, meaning this meat production becomes cheaper. Supermarkets and food outlets can produce this cheaper meat without ever declaring it to the consumer, and this is not what was intended by legislation. We have seen many examples of this over the last 15 years. Britain's biggest retailers, such as Sainsbury's, Tesco's, Marks and Spencer's and Asda, have sold halal or kosher meat without informing the consumer, as well as places like Domino's, Pizza Hut and KFC. And non-stunned produce is being used by 17 local councils in schools, the majority of which are not Islamic faith schools, without parents or children having the first idea about it, as well as it also being served in hospitals and in local councils. So in December, when Labour put forward its much vaunted animal welfare strategy, a document lauded with the aim of preventing animals suffering unnecessarily, which included the banning of boiling of live lobsters, banning the use of carbon dioxide to stun pigs, and steps to ensure the more humane slaughter of farmed fish, I was surprised and alarmed to see no mention of the more humane slaughter of animals and the labelling of halal and kosher meat. There was a clear opportunity to call for this labelling of halal and kosher meat, and it was missed. Nowhere in Labour's 12,500-word animal welfare strategy was it mentioned. We often hear in the House that the UK holds the status of a leader in animal welfare, but such a glaring gap shows this country can no longer make such a claim. Food for You Too, which is a biannual official statistics survey commissioned by the Food Standards Agency, found in 2024 that the most common spontaneously expressed food concern was food production method, and in August 2022 the government's call for evidence on labelling for animal welfare found that almost 99% of respondents said method of slaughter labelling should be introduced. Absolutely. Research from the Agriculture and Horticultural Development Board shows that clear halal certification is stated as important for 92% of halal consumers. So isn't it time we updated our regulations and demanded our meat was clearly and fully labelled so we know what we're buying and eating? Surely that is what consumer choice is all about, and I would wager that the overwhelming majority of animal lovers in the UK expect the House of Commons to support this bill today. Mr. Speaker, this bill will provide that assurance to all consumers that they know how their meat was produced. And I would urge all members of this House to support this measure.
That the right honourable member have leave to bring in the bill. The question is, the right honourable member have leave to bring in the bill. As many of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Who will prepare to bring in the bill?
Sir Roger Gale, Alberta Costa, Dame Karen Bradley, Sir Edward Lee, Graham Stringer, Rupert Lowe, Sammy Wilson, Jim Allister, Lee Anderson, Sarah Pochin and myself.
Yeah, very good. Esther McVeigh.
Food labelling, halal and kosher meat bill.
Second reading what day?
10th of July.
10th of July. I think I remember your husband doing something similar. Order. Before we begin the debate on Andrew Mountbatten-Windsor, we all ready? Okay, let's try again. Order. Before we begin the debate on Andrew Mountbatten-Windsor, I would like to make a brief statement. I understand that there is a huge interest from the public on this matter, and there has been significant coverage in the media. It is, and always has been, possible for the House to properly debate these matters within the framework of our existing rules, and there has been no change of convention in that respect. Whilst matters relating to Andrew Mountbatten-Windsor's recent arrest are currently not sub judice, members will be aware that there is an ongoing police investigation. I would therefore gently say to members that it will be helpful to exercise a degree of restraint. I know the House would not wish to do anything that risks prejudicing any possible prosecution. And of course, any comments on the King or the heir apparent would also not be in order. Right, we now come to the Opposition Day motion on Andrew Mountbatten-Windsor. No, then I think it's changed to Sir Ed Davey, a different name than I've got here. Sir Ed Davey.
Thank you, Mr. Speaker, and thank you for your statement ahead of this debate. The appalling crimes of Jeffrey Epstein and his associates have rightly stunned the whole world. The scale of Epstein's operation was shocking, selling human beings for sex, turning hundreds of young women and girls into victims and survivors. And it is those women who are at the front of our minds today as we finally seek transparency, truth and accountability. Mr. Speaker, Andrew Mountbatten-Windsor shamed our country and the royal family. But for too long, members of Parliament were barred from even raising criticisms of him, let alone properly scrutinising his role as trade envoy. Because of the outdated tradition that mentions of any member of the royal family in this House must, in the words of the previous Speaker, be, and I quote, very rare, very sparing and very respectful. I encountered this firsthand back in 2011 when I was asked to respond to an adjournment debate on behalf of Lord Green, who was then the Minister for Trade and Investment. The adjournment was brought by the late Paul Flynn. But even he, an ardent and outspoken Republican, as I'm sure many of us remember, wasn't allowed to raise any actual concerns about Andrew himself. Paul called it a negative privilege, and that's what it was. He said his mouth was bandaged by archaic rules, and that had very real and damaging consequences. And I'm pleased to see the Minister in his place, because I know he was also constrained by those rules when he raised similar issues. And in that debate, Epstein's name wasn't even mentioned once. There was no chance to debate the substance. And standing in for the responsible minister, I set out the government's position as it had been for a decade, in support of the Prince's role as the trade envoy. Looking back and knowing what we all know now, I'm horrified by it. I can't imagine what it must have been like for the survivors and their families to hear Andrew praised like that, as they heard so often all around the world. So I apologise to them, and I'm determined to change things. Mr. Speaker, I was struck by the words of Amanda Roberts, Virginia Giuffre's sister-in-law, after Andrew was arrested last week. She said this could be a stain on the royal family for the rest of our history, or, quote, it could be a moment where they and we decide that this is the time when cultural change happens. And as a staunch supporter of His Royal Highness the King and the royal family, I believe we must help to bring about that cultural change now.
Would he give way?
Happy to give way.
I'm most grateful to the leader of the Liberal Democrats for giving way. He's making a powerful speech. I'm sure will agree that decades of deferential, frankly sycophantic treatment by Parliament and state authorities are being exposed as having enabled Andrew Mountbatten-Windsor to behave as though he were untouchable. Yep. And I'm sure he will join me in calling on the government to introduce independent oversight of those members of the royal family who undertake official duties and require both transparency and scrutiny over anything from now on paid for by the state, because apparently they work for us.
I'm grateful for that intervention. We must build a culture of transparency and accountability. I think that is essential. And I hope we as a House will look at ending the archaic negative privilege rules Paul Flynn spoke about. Remove the bandages from our mouths. And today, free of those bandages in relation to Andrew, our motion focuses on finally getting the truth out about his role as Special Representative for Trade and Investment. I'll give way again.
Mr. Speaker, first of all, can I commend the right honourable member for bringing, and his party for bringing this forward. Commend him for the way that he interviewed on TV this morning. And certainly, he doesn't just speak for this House, he speaks for this nation. And we're all greatly shocked at what has taken place, but does he agree as well? King Charles, Queen Camilla, Edward, Sophie, William, Kate are members of the royal family at this time who also need our support. And does he agree that perhaps maybe now is a time to tell them that we in this House love them, that this nation loves them, and that we understand the pain that they're suffering, and our support is with those members of the royal family who are above this and above this reproach?
I'm grateful for the honourable gentleman's intervention. I think he probably speaks for the whole House. And indeed, the intention of this debate is to bring this House together. And the changes that we think are necessary would indeed protect the royal family and strengthen the monarchy, which in some places is being criticised, and I think it's important, and that's why we need these reforms. But, Mr. Speaker, if I can go back to the motion, because it focuses at the start of this, at the appointment of the former Prince Andrew to this role back in 2001. We've seen the reporting that the King, then Prince of Wales, expressed his concerns about that appointment. More alarmingly, we have read that Peter Mandelson wrote to the then Prime Minister Tony Blair, as his former Trade Secretary, pushing for Andrew's appointment. One friend of Epstein lobbying for a job for another friend of Epstein, a job that might help Epstein enrich himself. So we clearly need to get to the bottom of that appointment and the role Mandelson himself played in it. And only the papers demanded by this motion will allow us to do that. We need them published as soon as possible, without delay. And then there are the many questions about Andrew's conduct in the role, now subject to a criminal investigation. So clearly, Mr. Speaker, as you said, we do not want to jeopardise that investigation with anything we say today. We must let the police get on with their work, especially for Epstein's victims, survivors and their families. They deserve to see justice done at last. But I would just highlight one example of the way Jeffrey Epstein sought to use Andrew's role as trade envoy to enrich himself. I'm happy to give way.
I thank my right honourable friend for giving way. My right honourable friend talks about Andrew Mountbatten-Windsor's role as a trade envoy. When I was working overseas for the British Council, Mountbatten-Windsor came to an exhibition that I was putting on about Dolly the sheep, which was a fine example of British scientific innovation. Mountbatten-Windsor stood up in front of Japanese dignitaries and business people and said, "This is rubbish, this is Frankenstein's sheep." Would my right honourable friend agree with me that that's a very poor example of promoting British trade interests?
Well, I'm grateful for my honourable friend's intervention. It shows that not only some of the scandals that we've heard about are things that we need to focus on, but if the trade envoy was actually speaking against British commercial interests, that raises even greater questions. And I hope not just this debate, but other debates in select committees and elsewhere will get to the bottom of that issue. But I was saying I would like to highlight one example of how Jeffrey Epstein sought to use Andrew's role as trade envoy to enrich himself. Channel 4 uncovered emails in the Epstein files in which Epstein was trying to meet the Libyan dictator Gaddafi in the dying months of the Gaddafi regime to help him find somewhere to put his money. I think something that the minister actually raised at the time. In other words, Epstein looked at the deadly crisis in Libya and saw a chance to make some money. And he thought his friend Andrew could help. And this is what it says in one of the emails. "I wondered if PA could make the intro." A few weeks later, Andrew wrote back, "Libya fixed." Though the Epstein-Gaddafi meeting doesn't appear to have happened, it does show clearly what these relationships were all about for Epstein, increasing his own wealth and power. The idea that the role of Special Trade Envoy for our United Kingdom may have been used to help him do that, to help a vile paedophile sex trafficker enrich himself, is truly sickening. And again, I want to pay tribute to the Minister who tried to raise this at the time, like his colleague, the late Paul Flynn. And it shows, again, why we need to change the rules of this House that govern the debate here and ministers. But Mr. I give way.
I thank the Leader of the Opposition for giving way. I posed the question. Sorry, the leader of the Liberal Democrats. I stand corrected. The Leader of the... It's coming. I thank the Leader of the Liberal Democrats for giving way. I asked the question to the Chief Secretary yesterday in this House about the speed of bringing legislation forward. Victims, other members of the House, members of the Lords, we all need this process to be done as swiftly as possible. I just wondered if you agree that whatever happens with Andrew or anybody else, that you also agree that the Chief Secretary's comments that we do need to bring this forward and that we need to keep pushing to get legislation swiftly, not in years to come.
Well, I'm grateful for the honourable gentleman's intervention, both for his Freudian slip and indeed for his suggestion that we do need to speed up action in this area. But if I can begin to conclude, Mr. Speaker, in many ways this is the first truly global scandal, from the White House in Silicon Valley to Oslo and Paris. But it's also a deeply British scandal, reaching right to the top of the British establishment. Because can there be many people more symbolic of the rot that eats away at the British establishment than the former Duke of York and Special Trade Envoy, and the former Business Secretary, First Secretary of State and Ambassador to the United States? Their association with Epstein and their actions on his behalf, while trusted with the privilege of public office, are a stain on our country. Today we must begin to clean away that stain with the disinfectant of transparency. Because whether it is the President of the United States and his Commerce Secretary, or Peter Mandelson and Andrew Mountbatten-Windsor, or Epstein himself, their victims and survivors have seen those responsible evade accountability and escape justice for far too long. I desperately hope that is ending now, and I hope the House will approve this motion.
Yeah. The question is, that's on the order paper. I call the Minister, Sir Chris Bryant.
Thank you very much, Mr. Speaker. Mr. Speaker, let me be clear from the outset. We support this motion today. Frankly, it is the least we owe the victims of the horrific abuse that was perpetrated by Jeffrey Epstein and others. The abuse that was enabled, aided and abetted by a very extensive group of arrogant, entitled and often very wealthy individuals in this country and elsewhere. It's not just the people who participated in the abuse, it's the many, many more who turned a blind eye out of greed, familiarity or deference. To my mind, they too were complicit, just as complicit, and I welcome the reckoning that is coming to them now. I doubt there is anyone in this House who is not shocked and appalled by the recent allegations. Colleagues and many civil servants have told me their own stories of their interactions with Mr Mountbatten-Windsor, and they all betray the same pattern. A man on a constant self-aggrandising and self-enriching hustle. A rude, arrogant and entitled man who could not distinguish between the public interest, which he said he served, and his own private interest. I remember him coming to visit the Sea Cadets in Tonopandi. They were absolutely delighted and excited to meet a member of the royal family. But he insisted on coming by helicopter, unlike his mother, who came twice to the Rhondda and always came by car. He left early and he showed next to no interest in the young people. That is, of course, Mr Speaker, not a crime, nor is arrogance, fortunately, I suppose. Of course, we knew much of this, much of what is now in the public domain, actually a very long time ago. And I say very gently, it is all very well for some of us to say, if only we had known then what we know now, but I'm afraid that with me that doesn't wash. We did actually have plenty of warning. I called on the then Prime Minister David Cameron to dispense with the services of the then Duke of York in this chamber on the 28th of February 2011 because of his close friendship with Saif Gaddafi, as has just been referred to, and the convicted Libyan gun smuggler Tariq Kaitouni. I was rebuked by Speaker Bercow then for doing so because references to members of the royal family should be very rare, very sparing and very respectful. I didn't disagree with the ruling of Mr Speaker, nor would I ever, as you know, Mr Speaker, disagree with the ruling from the chair. I heard that. Over the next few days... I'm taking your advice, Mr Speaker, I'm just ignoring that. Over the next few days, back in 2011, I repeatedly called for Andrew to be sacked in the public domain on television, on radio and in newspaper articles, citing his relationship with Jeffrey Epstein, the mysteriously excessive £15 million cost paid for his Sunninghill home and many other issues besides. I'm afraid the willful blindness of far too many at that time was absolutely spectacular, and it still angers me. The then Prime Minister, the then Home Secretary and many others in government defended Andrew time and time and time again. I was repeatedly told off, both in the chamber and outside the chamber. John Humphreys, the broadcaster, actually told me on the Today programme on the 7th of March, I think honourable members will be shocked by this, that Jeffrey Epstein wasn't quite a paedophile, drawing a distinction between sexual abuse of prepubescent and other children. Dominic Lawson, writing in the Sunday Times on the 11th of March, defended Andrew and made the same distinction between Epstein's involvement with teenage girls and paedophilia, since, as he put it, none of the girls was prepubescent, although he did at least admit that both were sordid and exploitative. I gently suggest that that is the least of what we have seen. So let me be absolutely clear. All of this happened after the photograph of Andrew with his arm around Virginia Giuffre was published in the Mail on Sunday on the 27th of February 2011. It is after the allegations, not before. Well, I'll give a word there and then to the end.
Thank you, Mr Speaker. I'm grateful to the honourable member for giving way, and I entirely agree with him in relation to the abhorrence of the comments that were in the media back then. But does he also agree with me that we still have a degree of that problem now, that often in the media we talk about underage girls, where actually what we're talking about is children? And does he agree with me that we should be ensuring that when we talk about Epstein's crimes, we talk about the children that were involved?
100%, and I think we should also be referring to statutory rape, because that is what it is. And statutory rape is no better than any other kind of rape. It is rape. End of story.
Of course. Grateful to the Minister for giving way, speaking very powerfully about this issue, and has a strong track record, one of the strongest track records in standing up on these types of issues. I have asked that the Government release the files concerning whatever his new name is, Andrew Mountbatten-Windsor, when he was a trade envoy. That request has been refused. Can I ask gently the Minister to review that decision, and to ask that all of these files, in the new spirit of openness and transparency, that those files are open for all to see?
Of course, I completely respect my honourable friend, and he's made this point several times, not only in the chamber but also to me privately. And I agree with him. That is the direction of travel that we're going in, and that's why we agree with the humble address today as it's been presented. We're not standing in the way. We will do everything we can to comply with that as fast as we possibly can. I will come on to a couple of caveats a little bit later, but I just want to pursue the point about what we knew in the past, because the leader of the Liberal Democrats quite rightly said that on the 7th. That Paul Flynn had a debate on the 4th of May, to which he responded as not actually as the Minister responsible, but standing in for the Minister responsible. But actually, Paul Flynn also had another debate on the 17th of March in Westminster Hall, which was granted to him by the Backbench Business Committee, which had relatively recently then been set up. And he concluded, because he was finding it very difficult to make any of the allegations that he wanted to make because of the rules of the House, that there really is no point in continuing with the debate. That is a direct quote from him. And in fact, the then Deputy Leader of the House, David Heath, who was another Liberal Democrat member of the government at the time, made the point that, as I think, Mr. Speaker, has been made both by Mr. Burko and by yourself, that if there is a substantive motion, of course we can make these comments in relation to certain members, but it has to be a substantive motion, and you have to find a means of being able to table that motion, as indeed we have a substantive motion today. And then, following that, Paul Flynn tried to get a substantive motion, which was then the debate, but it was actually an adjournment debate on the 4th of May, which is therefore not a substantive motion again, and he struggled again, and this is what he said in that debate. The Speaker would quite rightly abide by the rules of the House and tell me I was not allowed to make any derogatory statements that might affect the envoy, his personality or his name. It is an illustration of how demeaned we are as politicians and members of Parliament that I am allowed to make any points about the damage that is done only in an oblique way, by discussing the effects of the holder of the office, his role, and the comments that are being made. And of course, he felt furious, angry. He wrote a great book about being an MP, which I commend to all honourable members. And the Right Honourable Member, as he knows, he responded to that debate as follows. I, for one, believe that the Duke of York does an excellent job as the UK's Special Representative for International Trade and Investment. He promotes UK business interests around the world and helps to attract inward investment. He went on at some length and then added at the end, he has made a valuable contribution in developing significant opportunities for British business through the role and continues to do so. I just say gently to him, I think if he'd followed the debates in the public domain at the time, he would have known better than to have made those comments. I won't go any further, but I'm happy to give way if he wants.
Well, the Minister knows that I apologise for that comment. Taking the brief from someone else, I really wish I hadn't said those words, because I'm thinking about the victims. And I praised him for the role he took. I hope he will acknowledge that 2 months after that debate, Andrew left that role, and that was right that he did. And the government, I wasn't privy to those discussions, but the government did get rid of him.
Yes, he left his post in July, I think, of 2011. It could have come soon enough for many of us, and it is a regret, I think, to many that the government wasn't able to listen faster and to act faster at that time. Mr. Speaker, what I believe this whole saga shows is that deference can be a toxic presence in the body politic. Of course, we always seek to respect others. We look for the best in others. There was another instance in that first debate that shows the generosity we often show, and I have told the honourable member that I'm going to raise this. The Right Honourable Member for New Forest East, who is a gentleman to his fingertips and is always a very magnanimous fellow, said, "Does the Minister agree that one reason why the Duke of York has considerable credibility is his distinguished record as a former member of the Fleet Air Arm who gave valuable service in the Falklands War? That shows a degree of commitment over and above any inherited responsibilities that he might be considered to have." Of course, I understand the point that the Right Honourable Member was making back then in 2011. But of course, the fear is that when deference tips over into subservience, it can be terribly dangerous because the victims don't get heard, respected or understood in the same way as those with grand titles do. And this, of course, has implications for this House, as the Right Honourable Member said. Mr. Speaker, of course, the conduct of business in this House is entirely a matter for you, and interpreting with the clerks the Erskine May and the standing orders. I only repeat the words of Paul Flynn in 2011, who denounced what he called censorship on honourable members discussing an issue of great importance. I know you too would want to denounce such censorship. I want to issue one caveat about the motion today. The Government will, of course, comply with the terms of the humble address in full. As I say, we support the motion. But as the House will know, there is a live police investigation into the former Duke of York after his arrest on suspicion of misconduct in public office. The House will also be aware that following that arrest on the 19th of February, Buckingham Palace issued a statement on behalf of the King. His Majesty emphasised that the law must take its course and that the Palace will provide its full and wholehearted support and cooperation. The statement concluded with a commitment that His Majesty and the royal family would continue in their duty and service to the nation. Mr. Speaker, I'm sure that is a sentiment that the whole House will support. As the police have rightly said, it is absolutely crucial that the integrity of their investigation is protected. And now these proceedings are underway, it would be wrong of me to say anything that might prejudice them. Nor will the Government be able to put into the public domain anything that is required by the police for them to conduct their inquiries unless and until the police are satisfied. I'm sure the Honourable Member would agree with that point. Yes, of course.
I agree with everything he's saying, but I think what's worrying quite a lot of us, and not just concerning Andrew Mountbatten-Windsor, but Manderson as well, is that because of these ongoing police investigations, and because the wheels of justice grind exceedingly slow, it might be years before we see any of these papers. And I just really want to have an assurance from the Government that they will do their utmost, despite what he just said about the police investigation, to ensure there's full transparency, because actually scandals are made much, much worse by any sense of cover-up.
I couldn't agree more with the honourable gentleman. I want to make sure that we move as fast as we possibly can, but I also want to make sure that justice does happen, and I don't want to do anything that would undermine the police investigations. I hope that they will be able to move as swiftly as possible, and we will certainly cooperate with them as swiftly as possible. I should just say it's worth bearing in mind that the documents that might be envisaged in this are mostly 25 years old, some of them a bit earlier. They may be substantial in number, and many of them will be in hard copy. So I hate to add to the Right Honourable Member's fears about the speed with which things may be able to happen. But I think we would all want to make sure that we do all of this in a proper fashion. All of that, yes, of course.
Giving way, and as a point of clarification regarding the police investigations, he might have seen the intervention that Gordon Brown made on Sunday, asking constabularies to consider widening the probe on the basis of files that had been released as part of the data dump. One of the questions that's arisen, and I appreciate he won't be able to comment on what those police forces are planning to do or not do, but that all government departments, including the Ministry of Defence and including the Department for Transport, would be fully cooperative with anything that they would need. Could he give the assurance that every single department, without fear or favour, will give them whatever they need if they wish to widen the investigation?
We will do two things. First of all, we will seek to comply with the humble address as soon as we possibly can, given the caveat that I've already issued about the police investigation. We will also make sure that every single part of government cooperates entirely with both the Thames Valley Police and any other investigations by any other police forces, police force that there may be on whatever they may be investigating. It's not for me as a government minister to instruct the police what they should or shouldn't investigate or point them in one direction or another. Former Prime Ministers have a different set of responsibilities so she's quite right. I don't want to undermine the investigation, but I also don't want to delay it in any way, and we will make sure that every department... yes, I don't want to give way to every single member of the Liberal Democrats, but I will, of course.
I thank Minister greatly. Would he agree with me that it's actually timely, right now, that the government...
in the Children's Wellbeing Bill from the other place would allow the Secretary of State to do. Now, I'm happy to give way.
And in amongst the discussion around procedure, which is important in this place, I do fear we're missing kind of the nub of what she's trying to get to, which is that this is a nuanced space. This isn't a blanket, we say no to everything, and there are some people who are arguing that we should do nothing and that it should be just down to parents to do it. Would you agree with me that actually this thoughtful way that she is putting across, trying to get us all to come around this with the public, is the way we're going to create something that is future-proof, because so much of legislation in this area is chasing our tails, and this is an opportunity for us to get ahead of it for once.
I thank my honourable friend for her intervention, and that is indeed what we're trying to do, because actually just trying to put forward a blanket ban on a particular list of social media sites determined by any given Secretary of State at any given point in time is necessarily acting after the fact, is not future-proof and not particularly effective, I would say, and subject to politicisation, and which is why our harms-based approach, which is what I would want to negotiate to try and get into legislation soon, would be future-proof and work to act on things like chatbots and games. And I know from the discussions we have at home how addictive games such as Roblox, for instance, can be. Now, we Liberal Democrats have long been pressing for a suite of measures that would make the online world safer and healthier for all. Now, one measure that could be implemented overnight would be to ban tech companies profiting from our children's attention by raising the age of digital data consent from 13 to 16. Now, this would end the hold that addictive algorithms have on children.
Point of order, Madam Deputy Speaker.
Point of order, Gareth Snell.
Because whilst the Honourable Lady is making an excellent point on the substance, it bears no resemblance to the motion on the order paper. So are you, as a chair, able to give me guidance on what is up for debate this afternoon, and if the Honourable Lady can point me to what she's debating now and where that sits in the motion in front of us?
For his point of order. What is clear is that there is a motion on the order paper on which members will presumably be asked to divide in due course. However, what that does not give is any detail of the proposed bill. But the motion on the order paper is orderly, and it will be up to members to decide how they wish to vote on that.
On a further point of order, Madam Deputy.
Point of order, Paul Holmes.
Madam Deputy Speaker, I'm grateful for your indulgence, and I suspect I will get the same answer as the honourable gentleman before me, but I have never in my 7 years in this House been in a situation where a motion outlines the timetable for a bill on Monday the 9th of March, the timings of proceedings and questions to be put on Monday the 9th of March, on consideration of Lord's amendments and messages on a subsequent day, of a bill that this House has not seen. So how can members in this House vote for a motion that allocates separate procedures around a bill that hasn't been tabled at this House? Madam Deputy Speaker, I want my constituents to know what the Liberal Democrats are proposing in this space, and the Honourable Lady's now elaborating on the floor of the House what she wants her policies to be, but she's asking us to vote for a bill that has not been tabled before this House, Madam Deputy Speaker. Therefore, can I have your advice on whether this motion should be going ahead if the House has not got a substantive bill to debate these procedural motions on?
I thank the honourable member for his point of order. The motion that is on the order paper is perfectly orderly, so members will be invited to vote on that, not on the substance of any bill that might come on the 9th of March. And I do think it is important that the House is clear on that. Point of order, Chiomura.
Thank you, Deputy Speaker, for allowing this point of order. So it's further to that point of order in terms of how I can assess what is orderly in my contribution in this debate, given that the substance of the motion is about process. And to be frank with you, I don't want to speak about process, I want to speak about protection for children.
It's a motion to give consideration to. So, the motion is to give consideration to a bill on the specific matter which has been outlined on the order paper very clearly, protections for children from online harms. So can I reassure the Honourable Lady that any contribution she chooses to make on that matter would be in order? Munira Wilson.
Thank you very much, Madam Deputy Speaker. And that's why what I'm setting out is what I would want to put forward as suggestions for that bill. But as she has helpfully pointed out, we would be dividing on whether there should be a bill very soon on the broad subject of protecting children from online harms. Now, the other thing that I would want to bring forward in any legislation would be a doom scrolling cap, which would end the infinite scroll feature on short-form online platforms for young people, limiting the amount of time for which children are pushed to TikTok-style video content to 2 hours, and for health alerts on social media platforms for under 18s. Now, just like cigarettes or alcohol, these addictive products carry well-documented risks, especially for young people. The evidence is clear that excessive use of these apps exposes children to mental health issues, to anxiety, sleep disruption, and to real harm to attention spans. And don't they deserve to know that? When we pick up a packet of cigarettes, we expect to be told about the harm that product will pose to our health. So why is social media the key driver of a crisis in our young people's mental health any different? Now, and given that young people themselves are saying that they want a break from the stress of social media at school, and given the impact of phones on children's concentration and focus, will the Education Secretary finally listen to her own children's minister and put the government's guidance on mobile phones in schools into law to give teachers and head teachers the backup and, crucially, the resources they need in order to restrict their use? That is also, I think, something that could be part of this bill if the government refuses to accept the amendment that will be coming from the other place in the Children's Wellbeing and Schools Bill. Now, I recognise the Technology Secretary has announced a consultation on children's online safety and also that she will be tabling an amendment to the Children's Wellbeing and Schools Bill to enable further legislation to come forward on something at some point in the future, all as yet to be determined. Frankly, they're kicking the can down the road. And to quote Baroness Kidron in the other place, who's an expert and a campaigner on children's safety online, she said about the government's consultation, "It does not concern itself with the gaps in provision or enforcement of the Online Safety Act, nor the emerging or future threats that we repeatedly raise. It does not seek to speed up enforcement or establish why non-compliant companies are not named in Ofcom research or while they are being investigated. The consultation is entirely focused on 2 amendments that this House might send to the other House, which its backbenchers might agree to. The consultation's purpose is to stave off a backbench rebellion. It is not about child safety or governance, it is about party management. The UK's children deserve better than that." Now, that's not my words, Madam Deputy Speaker. That is the esteemed crossbench peer Baroness Kidron in the other place. Now,
The Honourable Lady give way.
I'm very happy to give way.
I thank the Honourable Lady for giving way. I had understood that her party was keen on public consultation, and there's clearly a lot of public concern over this very real problem of online harms and the need to protect children from it. So I am puzzled by the fact that she is seeking to control the parliamentary agenda in just a couple of weeks' time without any substantive proposals and rush through legislation without any consultation. If she's concerned about the scope of the consultation that the government has announced, why not try to amend the scope of that consultation, and why not emphasise the importance of parents in particular having their voices heard rather than rush through potentially probably quite flawed legislation if there is not sufficient time to ensure that everybody's voices are heard in this conversation. It feels like politicking, to be honest, rather than a substantive engagement with the details of the issue.
I'm sorry she feels that way, because we've brought forward a lot of these proposals previously, so it's not politicking. We've long been committed to this issue. And because a number of these things could be done tomorrow. They don't need to be consulted on. The age of digital data consent could be raised tomorrow without any further consultation. It's something that was set by European law. There was flexibility in what age it was set at. UK chose to set it at 13. A number of other countries have recently raised their age. Unfortunately, amendments to the data bill were rejected to do just that. I think the bit that probably does need consultation in how it would work would be how any sort of ban or restrictions on harmful social media would work. But I think we could legislate for the principle and consult on the operational detail.